Study reveals disparities in Minnesota's COVID-19 vaccine rates. A new study from the University of Minnesota Public of Health (SPH) State Health Access Data Assistance Center (SHADAC) shows that vaccination rates for some racial and ethnic groups lagged behind rates for the state's white population. The study calculated time to vaccination outcomes, estimates of the length of time it took to vaccinate 50% of people in different demographic subgroups, which reveal examples of the inequities in Minnesota's COVID-19 vaccination efforts. Key findings include overall vaccination rates, high disparities. While Black, Latino, and white residents of Minnesota had similar COVID-19 vaccination rates by the end of 2022, there were stark disparities in time to vaccination. While Minnesota fully vaccinated 50% of white residents within 6 months, it took roughly twice as long to fully vaccinate 50% of Black and Latino residents. Minnesota underperformed in vaccinating American Indian people. By the end of 2022, just over half of Minnesota's American Indian and Alaska Native population had been fully vaccinated against COVID, compared to 65% of white people. Additionally, it took Minnesota 15 months to vaccinate 50% of its American Indian and Alaska Native population, roughly 2.5 times longer than it took to research 50% of the state's white, Asian, and Native Hawaiian and Pacific Islander population. Minnesota lagged in vaccinating young adults. The state took 8 months to fully vaccinate 50% of young adults from the time vaccines were first authorized. By the end of 2022, only about 2/3 of young adults were fully vaccinated. Minnesota rapidly vaccinated its elderly population. The state was able to fully vaccinate 50% of elderly residents within 3 months of when the first COVID-19 vaccine received emergency use authorization. Minnesota performed best in vaccinating urban and suburban areas. At the end of 2022, almost 3/4 of Minnesota's urban and suburban populations were fully vaccinated against COVID-19, compared to just over half of people in rural, exurban, and small town communities. Similarly, Minnesota was faster to vaccinate people in urban and suburban communities. Disparities in the distribution of COVID-19 vaccines highlight the shortcomings and pervasive inequities in the U.S. healthcare and public health systems, says Colin Flannel, a senior research fellow at SHADAC and the study's lead author. Identifying these disparities, especially the glaring differences in the time it took to vaccinate various populations across the state, can be a useful tool for policymakers and public health officials in addressing future health emergencies. To conduct the study, researchers from SHADAC analyzed data from the Minnesota Electronic Health Record Consortium, which includes the Minnesota Department of Health, several large healthcare providers, and other organizations dedicated to measuring and improving healthcare quality in Minnesota.